Good evening, everyone. I'm Michelle Leifer, the director of the Usedan Institute for Animal Health Education at the Schwarzman Animal Medical Center. Along with my colleague, Valeria Menendez, I want to thank you for joining us for tonight's webinar, Meeting Your Dog's Needs with Dr. Vanessa Spano and Maddie Messina. This webinar is for educational purposes only and is not a substitute for professional veterinary advice, diagnosis, or treatment. If you have any questions or concerns about your pet's health, we always recommend reaching out to your veterinarian. Tonight's event is being recorded and we'll send out a link tomorrow in case you'd like to watch it again or share it with others. We will also be sending out links to resources mentioned in tonight's lecture, so don't worry about trying to write down the information. We'll be sending you those links. We'll be taking questions via the chat box, which I will enable at the end of the presentation, and we'll answer as many as possible. We're unable to answer questions that are very specific to an individual pet. So again, if you have any very specific questions, please reach out to your veterinarian. I'd like to take a quick moment to highlight a couple of upcoming events. On April 22nd at 6 p.m., Dr. Renee Schmid, Veterinary Director at Pet Poison Helpline, will be leading a webinar on pets and poisons. Registration details are available at amcny.org/events. And I am very excited to share that AMC's Paw Day Health and Wellness Fair will be on Saturday, May 2nd from 11 a.m. to 5 p.m. AMC will take over an entire block on 2nd Avenue between 76th and 77th Streets. And it's a fantastic opportunity to meet AMC's veterinary teams and enjoy a wide range of fun, hands-on activities for people and pets. Dr. Spano will be there and the behavior team, so please come out and join us for that. It's totally free. It's very, very fun. We'll be sharing more information about that in the coming days. And it is now my pleasure to introduce tonight's speakers. Dr. Vanessa Spano is a board-certified veterinary behaviorist, one of fewer than 100 in North America. She is the head of the behavior service at AMC. She earned her veterinary degree from the Atlantic Veterinary College in Canada and completed a rotating internship at the ASPCA, where she worked with animals involved in humane law enforcement cases. She then pursued a residency in veterinary behavior and became board certified by the American College of Veterinary Behaviorists. Dr. Spano's expertise includes anxiety, aggression, trauma recovery, and compulsive disorders. Prior to joining AMC, she served as medical director of the ASPCA Adoption Center. And at AMC, she's helping expand access to specialized evidence-based behavioral care for pets and their families. Joining her is Maddie Messina, a certified applied animal behaviorist with over 10 years of experience. She holds a Bachelor of Science in Animal Behavior from Bucknell University and a Master of Arts in Animal Behavior and Conservation from Hunter College. Maddie began her career in veterinarian shelter settings where she saw firsthand the impact of individualized training. She later founded Pause for Thought Dog Training, a practice focused on thoughtful, solution-oriented approaches to complex behavioral challenges that often go beyond basic obedience. Her work spans puppies, adolescent dogs, and those with more significant behavior concerns, with a focus on building confidence and helping guardians develop stronger, more fulfilling relationships with their dogs. We're so pleased to have them both here with us this evening. Please join me in welcoming Dr. Vanessa Spano and Maddie Messina.
Hi, everyone. Thank you so much for joining.
Hi, guys. I'm so happy to have you all here.
Well, thank you for joining and thank you for that wonderful introduction, Michelle. Like she mentioned, I'm Dr. Vanessa Spano. I'm the head of the behavior service at the Schwarzman Animal Medical Center, and I'm really excited to be presenting with one of the most incredible trainers in New York City, Maddie Messina. We'll be going through these slides back and forth together. So I just wanted to provide some statistics for you guys. Um, Sorry. Uh, So, a survey from 2024 revealed that an estimated 59.8 million United States households own pets. But unfortunately, according to the Shelter Animals Count National Database in 2024, approximately 2 million of these pets were relinquished to shelters across the United States. And that number might be higher based on what wasn't reported. Many studies exist looking into the reasons for relinquishment, and whether the study goes as back as 2000 or as recently as in the 2020s, they consistently agree that behavior continues to be one of the top, if not the top, reasons cited for relinquishment. While these studies validate that having behavioral issues is a known risk factor for relinquishment and abandonment, I do want to also mention that other studies, unfortunately, also demonstrate that pets with behavioral issues are sadly more at risk for experiencing abuse and neglect, which is why we try to educate about all the different behavioral issues and what to expect when you own a pet to set expectations appropriately. So what were some of the top reasons for behavioral relinquishment to shelters, specifically for dogs? In no particular order, aggression, destruction, which can include things like digging, chewing, amongst other signs, excessive energy, disobedience, which can include things like jumping on people, pulling on the leash, vocalization, and house soiling, or specifically eliminating inappropriately when they should be appropriately potty trained. There's a study that I have cited on the side here, and I do have all of the references at the end in case anyone is interested in a particular paper. I'm happy to share that along. But in this study, owners were surveyed about their experience 1 month post adoption, and 50%, so half of those dog owners reported behavioral problems. Those with pets who were reported to have behavioral concerns reported a significantly more difficult adjustment period, unfortunately, than those with pets who didn't have behavioral concerns. Additionally, these pets were significantly less likely to visit with the veterinarian in that time because bringing the pet to the vet was a stressful experience. This is problematic because, number one, the pet may not receive the timely medical care should they need it. And also, number two, the owner may be missing out on appropriate behavioral advice and guidance from a veterinarian. I did want to highlight that in this study, the most common behavioral problems reported for dogs, similar to what was in the previous slide, were chewing, digging, or scratching at objects.
All right, so as Vanessa just mentioned, some of the behavior problems post-adoptions that were reasons for relinquishment included vocalization, digging, chewing, disobedience, like pulling on the lead or jumping on furniture, scratching, and lots of energy. All of these could be considered normal species-specific or breed-specific behaviors depending on the context. So, when an animal is unable to engage in normal species-specific behavior, then we're at risk of an actual problem behavior developing. These can include frustration, anxiety, displacement, and compulsive behaviors, amongst others. Additionally, while not always the case, many of these problems could be potentially avoided with the right environmental management, outlets, and enrichment. And this is where doing your research before considering adopting or buying a dog comes in. So, some things you should be thinking about are considering breed differences and learning why a certain breed may not be a good fit for your family. We actually have the Meet Your Dog book on this slide, which is a great resource for anyone who's interested in learning more about the different breeds of dogs and what were bred for and what their temperaments may be like. Um, you also want to educate yourself on the pros and cons of adoption. So, thinking about how a puppy or an adult dog might fit into your daily schedule. And of course, you need to do your research on a rescue or the shelter that you're planning on working with to learn more about where their dogs are coming from. In general, we want you to be a smart consumer. So, good breeders do testing, early puppy socialization, and typically they should not let you choose your puppy based on looks alone. We do have some resources which we'll be sharing with you after the presentation, that some of which include resources for finding good breeders. One of these is the Canine Care Certified program through Purdue University, and the other is the Companion Dog Project, which is a collaboration amongst breeders who are prioritizing health and temperament.
So, studies found that puppy owners who received behavioral counseling at their first veterinary examination reported significantly fewer undesirable behaviors than those owners who did not receive behavioral counseling. This can include counseling on pet selection for prospective owners, a comprehensive discussion, as I mentioned before, about the expectations of pets' medical and behavioral needs, and instruction on breed specific outlets. For example, it may not be appropriate to match owners with a mouthy puppy if they're likely to deem those behaviors problematic. And it may also not be appropriate to own certain breeds, which we'll go into a little bit later, in specific environments. Something that is not uncommon presenting to myself, and I'm sure Maddie, certain breeds in the herding in bustling cities like the herding breeds, where there's a lot of frequent, quick moving triggers on walks that can be frustrating when they can't access them. A more spacious environment is more appropriate, for example, for sporting dogs who do require ample opportunity for aerobic exercise. Beyond the veterinarian, other reliable sources of information include, but aren't limited to, trainers. And at the end of the presentation, I'll discuss how to pick, ideally, the most optimal trainer for your pet, behavior consultants, and of course, veterinary behaviorists, along with fear-free veterinarians who are veterinarians that are certified in recognizing signs of fear, anxiety, and stress and low stress handling. And of course, some online resources as well, such as the Whole Dog Journal, Every Dog Austin, or of course, my former employer, the wonderful ASPCA. Be wary, of course, of the information that you consume via the internet about your dog or puppy's behavior, and make sure you're speaking with or listening to a trusted source who has advanced behavioral expertise and education. So, a little sneak peek into my behavior consults, and I did see that some of my clients are on here. So, hello, everyone. Thank you for joining. They may recall that during my behavior appointments, I do like to perform something called functional behavior assessments when a pet is presenting with a problematic behavior. And this is something that I took actually that teachers will utilize for school children who are presenting with problematic behaviors or concerns. I do this for two reasons. Number one, I would like to try to determine what the function of the presenting behavior is, as just like us humans, every behavior that a cat, dog, etc. shows serves a function, and it's often a reaction to something in the environment. Determining that function will dictate the treatment plan and allow us to determine if we're meeting the pet's needs. So, for example, one of the main reasons for relinquishment behaviorally was excessive vocalization, but that could have multiple motivations, such as fear, protective behaviors, territorial, attention seeking, pain and discomfort, etc., all of which highlight that the pet is not simply engaging in this behavior just to be annoying. There is a function. And the second reason is to determine how can we manipulate the environment, should it not be a physical issue, but a behavioral issue, to prevent the pet from rehearsing this behavior, especially if it's problematic. I always say it is much more effective to try to change the environment than it is to try to change the patient.
Now, I'm going to walk you guys through the ABCs of a functional assessment. We always start with identifying the B, which is the anchor behavior or the problematic behavior in some cases. This is going to be the first step no matter what. So from there, we move out to the A and the C. With the A, we are identifying antecedents. So, what is occurring in the environment prior to the onset of the behavior or the start of the behavior? And if we want to change that behavior, we are thinking about how we can manipulate the antecedents or the environment that the behavior is occurring in. Then the C is identifying the consequences. So, what happens directly after the behavior that may be helping to either strengthen or weaken the possibility of that behavior occurring in the future. But before performing a functional behavior assessment, we must identify if the behavior is truly a problem, or as Vanessa mentioned earlier in her example, a breed-specific or a species-specific need that isn't being met or doesn't align with guardian expectations. All right. So now I'm also going to talk to you guys about how our dogs learn because it's important to understand this process so that we can adjust behavior accordingly. So one of the ways dogs learn or can be taught new things is through operant conditioning. This process relies on the consequence of a behavior. So, if we are reinforcing a behavior, we are trying to make that behavior happen more. And if we are punishing a behavior, we are trying to make that behavior happen less. It's important to remember as we go through the examples here. So, we have the operant quadrant on the slide that negative does not always mean something aversive is the consequence, and positive does not mean something pleasant is the consequence. So in operant conditioning, positive actually just means that we are going to add something to the environment. I'll give you the example of positive reinforcement. We ask a dog to sit, they do it correctly, we give them a treat. So we are adding a food consequence to strengthen the likelihood of the behavior. We're actually going to go through all of the quadrants, so bear with me. On the flip side, the positive punishment side, we can take, for example, a puppy biting us. Some might tap the puppy on the head to get them to stop. In that case, we are trying to punish or reduce the behavior by adding a physical correction as the consequence of the behavior. And then here's where most people typically get confused, which is negative. Again, that means that we are removing something from the environment. So for negative reinforcement, in this example, if your dog is pulling, you might tighten up the leash until they slow down. Then once they slow down, you release the leash to reinforce that slower walking. In this case, you are removing the pressure of the leash to encourage the slower walking. And then lastly, for negative punishment, a good example is the recommendation to turn away from your dog when they jump on you. So in this case, they are jumping on you for your attention, and you remove attention to decrease the or punish the problem behavior, which is jumping. And then here is the other way that we typically talk about dogs learning, which is classical conditioning. So at its core, conditioning is learning through associations, typically involving innate responses to stimuli. So, most people have heard of Pavlov's dog, where a scientist elicited drooling by presenting food to a dog. He then paired the sound of a bell with food. And eventually, the association between the bell and the food was so strong that just the sound of the bell would cause the involuntary response of drooling in dogs. Um, I'll give you guys another more realistic example for dog guardians. So before your dog has ever been walked on a leash, the leash itself doesn't cause any innate emotional responses. This is called the conditioned stimulus or the CS, which you can kind of see on the slide here. The outdoor environment on An outdoor environment, on the other hand, does cause innate emotional responses in your dog. For example, excitement. This is called the unconditioned stimulus or US. These are tongue twisters. And over time, by pairing the leash with a walk outside, the dog will gradually display the same behavioral response to the leash as they do with the outdoors. This is called the conditioned response. They have been conditioned through the association or the leash paired with the outdoors.
So, speaking of training methodologies, I did want to just briefly go back to operant conditioning, and one of the quadrants that Maddie had mentioned, which is positive punishment. I wanted to discuss reasons why veterinary behaviorists like myself advise against using these methods, just as a psychotherapist for children might. An example of positive punishment is, for example, a shock prong or vibration collar. Use of these aversive tools is not a form of negative reinforcement, and here's why. When a punisher or an uncomfortable stimulus, like a shock or prong, is applied at the time the patient demonstrates the undesirable behavior, in theory, the patient should learn with repetition that the undesirable behavior is associated with a painful or uncomfortable stimulus. And so, of course, they'll try to avoid displaying that behavior again to avoid experiencing that uncomfortable stimulus. However, in order for these tools to elicit enough of an uncomfortable stimulus to create an aversion, they must induce some degree of distress and fear, increasing stress hormones that you may have heard of, like cortisol and adrenaline. They have a similar biochemistry as we do. When such hormones are elevated enough, it, long story short, interferes with the gene transcription that is required for learning in the brain. And if anything, the patient isn't necessarily learning that much, but more just shutting down and demonstrating learned helplessness, akin to, unfortunately, depression in people. Additionally, while punishment aims to teach a pet what not to do, it does not teach the pet what to do instead. As I mentioned earlier, every behavior serves a function, and punishment does not address an alternative function. Without learning an alternative coping mechanism to fulfill the function, the pet doesn't know how to cope, leading to feelings of frustration and, again, helplessness, with a risk of returning back to rehearsing the only behavior he knows, the problematic ones that we're wishing to train them out of. Many problematic behaviors are rooted in frustration, fear, or anxiety, and punishment only worsens that frustration, fear, and anxiety. These bottled up emotions are at risk of eventually intensifying, and unfortunately, it's not uncommon for animals to start to direct these behaviors towards the teachers or the handlers bottling up those emotions. And finally, and this is usually where I might come in certain situations, helpful warning signs such as barking and growling that might often come before an actual bite are punished. As the next step for fearful and defensively aggressive patients, as demonstrated on the left-hand side, which I'll talk about a little bit more later on the ladder of aggression, is biting. If a punishment based tool is used to stop the barking and the growling, we are then potentially left with a dog that bites without warning. Now that we've talked about the different training methodologies, I did want to circle back to some of the behaviors that were listed as problematic and reasons for relinquishment and how they might actually be normal species specific behaviors. So, one, for example, is digging. The functions of digging can include aerosolization of scents, leaving scent marks, investigation, and actually thermoregulation. Terrier breeds can be predisposed. This means proactively, prospective owners of these breeds should be made aware that they should expect this digging behavior and that it's not necessarily a manifestation of disobedience depending on the context. And if this is not a desirable behavior, then perhaps we should maybe think of adopting a breed that's not necessarily a terrier. Retroactively, appropriate outlets to fulfill the need of digging once that has occurred includes things like burying treats, puzzle feeders, and we'll also be sending some literature after this, by the way, one of which is a document that I created on meeting dogs' needs with a lot of these different enrichment ideas. So puzzle feeders, filling kiddie pools with water and objects that the dog might find interesting to retrieve, earth dog trials, and as you'll see in this picture, lure coursing, which is where a mechanical apparatus that shoots out is placed underneath the ground, and the terrier need or the dog needs to dig and catch it, and it can be really fulfilling for this innate need. To prevent much damage when digging's occurring, you could consider placing soft paws nail covers. Again, that's manipulating the environment, not the patient. But also, one thing we need to consider when digging is not safe is, for example, escape seeking behaviors, such as that due to separation anxiety, which we'll talk about a little later.
All right. Okay, great. So Vanessa, would you mind playing the video after I'm done? Thank you. Okay, so we will have shortly an example of how we can harness your dog's interest in digging for good. So typically we see that as we give our dogs more outlets for species-specific behaviors that are approved, we see these behaviors pop up less frequently at other times. You can teach your dog to dig anything on cue, turning this into a fun brain game and a chance for them to perform an innate behavior, something that is inherently motivating. And as you'll see in this video, bonus points if you teach them to scratch a board that will also help them to file their nails.
So another great thing that Ginger has learned through paw targeting is how to file her own nails. And I'm going to demo that one as well today. This can be a great exercise for dogs who are a little bit nervous about you clipping their nails, and they can have a lot of control on filing their own nails. So Ginger loves to file her nails. This is a very, very cheap thing to make. It's just a clipboard with some sandpaper attached. You can either get sandpaper that just clips to your clipboard, or you can get the sticky kind that sticks right to a clipboard. And you'll notice with this, I did over time have to shape a little bit, good girl, to get that actual scratch, because it's not super helpful if she's just tapping it like she's doing with other paw exercises. So for this, it just took a little bit of time to be sure she understood when the clipboard comes out, it's not just touching it, it's also scratching down on it. Awesome work, Ginger.
And that can also be helpful for dogs that are fearful when it comes to nail trimming as well. So other behaviors that were deemed problematic and reasons for relinquishments included a lot of oral behaviors, so chewing, mouthing, and licking. But again, those are technically normal species-specific behaviors. How so? It includes things like food acquisition and nutrition, dental health, as well as the release of endorphins, as licking releases endorphins in dogs as a form of self-soothing behavior, and of course, scent gathering, such as for social interactions and prey detection. Some research suggests that chewing may be a way for dogs to moderate and reduce arousal. Note that licking body parts in dogs is not necessarily normal behavior. I always tell clients that grooming is a normal behavior in dogs, but it is not, or sorry, grooming is a normal behavior in cats, but self-grooming of dogs is not normal behavior. And when we see dogs that are licking themselves, sure, it could be secondary to a stress response, but we also want to make sure, as behavior is a diagnosis of exclusion, that we're not missing anything medical, because a dog, similar to how we might massage an area that's painful, a dog may lick an area that's really painful, or, for example, if there is an itch such as underlying allergies. Prospective owners for herding breeds should be made aware that these particular breeds are predisposed to this behavior, particularly in the form of nipping, as a means to control the movement around them, because that's what they were bred for. For example, the border collies or the Aussies. And another problematic behavior that might arise in this realm is, of course, puppy biting, play biting. And how should we handle this appropriately? I'll talk about in the next slide. Puppy mouthing increases as they become emotionally dysregulated, usually because the body needs something like potty, food, or rest. So appropriate outlets to fulfill the innate need of these oral behaviors might include things like a lick mat or a Kong, and you could freeze it to make it long lasting. A flirt pole, which you'll see on the upper left-hand corner, it looks like a really big cat wand. Nylabones or other vet-approved chew toys, of course, with supervision. And things like, as you'll see again on the lower left-hand side, sheep jog trials, and then herding balls, which I don't have a photo of, but they're basically big bouncy balls. They come in different sizes and they have tags at the ends of them so that the dog could pull on the tag and then push it as if they're mimicking herding behavior. Like I said, one problematic behavior that is in this realm is play biting in puppies. And so, how do we try to navigate managing this behavior? When the puppy is mouthing or play biting you, you should interrupt them in a calm, clear voice by saying nope. Don't yelp or attempt to make the sound of a dog in pain because they know that we're not dogs. Then, once you have interrupted, only pull away your extremity once the puppy releases. If you're pulling your arm or hand or whatever extremity away as the puppy's still biting you, it becomes a game of tug. So calmly and gently say no. Once they stop, release your extremity, and then you should immediately reward the dog and redirect by tossing, for example, a favorite toy or treat in the opposite direction, such as while saying good dog. This does require consistency among all household members. And remember that modifying behavior takes time. If these steps don't work, you may want to troubleshoot by considering perhaps the puppy is tired and needs to go to bed, or perhaps the puppy needs something else like the bathroom.
All right, as Dr. Spano mentioned, repetitive chewing can have a variety of benefits for your dog, and there is research that suggests that it can help them modulate their arousal and to decompress after stressful events. So I'll be showing you an example of a chewing activity that I actually give with my own dog and I encourage many of my clients to use as well. And in this case, we're just using everyday recycling from your home. So we've mentioned a lot of supplies that you could potentially purchase to enrich your dog's life through species-specific behaviors. But this is a reminder that not all enrichment needs to be expensive. Before we show you the video, because we have brought up a few different enrichment options, I did want to quickly cover when is the best time to incorporate enrichment to meet your dog's needs and hopefully lower their arousal. So first, you want to think about trying a variety of chewing and licking options in this case to figure out what works best for your dog. And there are some questions that you might be asking yourself. So does my dog engage in the activity or do they give up easily? And how do they seem after the activity? Are they calm or more energetic? So asking yourself those questions will help you to determine if and when to give a chewing and licking activity to best suit your dog's needs. You may have to try several options before you find the right fit. I always say, don't give up on the first bully stick. If your dog doesn't like the snow like mine, you might need to figure out a way to burn some of their extra energy today. So I'm going to walk you through a shredding enrichment prep that I filmed for a client. So what you'll see is me putting kibble into paper bags and then using tape to close those. I also use an old paper towel roll and even a old chocolate containing cardboard box. Don't worry, there's no remnants of chocolates in there. Some other options for shredding are egg cartons or even old Amazon packages. My dog naturally loves to shred and tear items, so this is a perfect way to take advantage of her predisposition for shredding and tearing. And this is something that we do whenever I can't give her runaround time and she needs a little bit of extra indoor mental stimulation. So give it a try. Let me know how it goes. I forgot about the music in that. That was like a party.
That's a lot of fun, and I can't wait to do that with my own dog. So another behavioral reason for relinquishment in dogs was listed as excessive energy, of which some dogs might be predisposed to, including the working group dogs, just like the beautiful shepherds and huskies, the sporting groups, such as retrievers, pointers, and spaniels, and again, the herding breeds. Additionally, dogs may seem to exhibit excessive energy if their needs for exercise are not met. This is particularly problematic in the urban environment for dogs because there's not a lot of space. And the urban environment is not a very natural environment for us, let alone dogs. And probably the most common thing that I see present to me, whether or not it's realized as the primary concern initially, is fear and anxiety on walks in the city because of all the loud noise, quick movements, etc. And so when these dogs that have a lot of energy are too fearful outside, it can be really hard to exercise them and meet these physical needs. You may consider increasing the amount of time outside with more and more walks, but that could be to the detriment of their mental health, again, if there is underlying fear or anxiety. Outlets to fulfill this high energy, of course, include things like trail walking, running, hiking. Believe it or not, in the city, in a few different boroughs, there are different indoor studios for agility, swimming, and like I mentioned in the digging slide, lure coursing. You could find some of those opportunities perhaps right outside the city in Long Island, Westchester, upstate. And indoor options can include things like scent work or nose work, including but not limited to Nina Addison's puzzles, snuffle mats, busy buddies, the IQ treat ball, and the tricky treat ball. Oh, I think Maddie, you're muted.
I've got it. Um, so, as Dr. Spano was mentioning, most dog breeds who are high energy, all dogs in general, will benefit from regular time in nature. So, off-leash hikes or long line walks are a great option. But the unfortunate reality is that many of our city dogs don't have access to off-leash experiences. And even for those, dogs living in more suburban or rural areas, if they have poor recall skills or behavior issues, off-leash runarounds may not be a good option for them either. So in this case, we typically recommend structured training classes as a good way to expend energy, meet mental stimulation needs, and teach valuable skills. You'll actually see in this video that we have two working breed dogs in the video. But we do recommend finding a group class that uses positive reinforcement training methods. So these are going to have a focus on building skills you want your dog to do rather than punishing skills you don't want. And any structured training positive reinforcement class like this will help you learn to communicate with your dog in a way that can also be easily transferred to other skills at home, and they are mentally and physically tiring.
Yes, so we're trying to fade the hand, right?
He's touching now. Yeah, that's exactly right with the target stick.
Yeah. Then you're gonna build duration, right? So not
Yes.
quite yet, but once you start getting, go find it.
Okay.
Yes. Oh boy. Okay. Yes. Good.
All right. And I do also like to talk about managing arousal. Um, one of the perils of living with a high energy dog is dealing with high arousal. And for those of you who don't know, arousal is simply a state of heightened physical and mental activity. And this can actually be considered part of your dog's temperament. So for those of you who are not aware, on the left-hand side of the screen, we have a graph which displays the Yerkes-Dodson law. So this law states that when animals are in either very low or very high arousal states, their performance will weaken. Many guardians of high energy dogs experience this. So they often feel like their dogs are bouncing off the walls, hard to manage and train. And this could be a result of maintaining high arousal states for too long. So we can help high energy dogs to modulate their arousal levels through a series of techniques. First, we absolutely need to be meeting energetic and mental stimulation needs, though this does not mean constant exercise. They do need species specific or breed specific outlets for their energy. We can also teach and reinforce calm behaviors. So these should be sprinkled in and after play or training sessions. And then I'm always talking about the human end of the leash, but we should be working on separation abilities so that you can walk away when you need a break from your dog and know that they are 100% calm at home. And then finally, clear communication systems through positive reinforcement training will help you to teach your dog new skills while avoiding frustration. Many dogs experience a lot of frustration from constantly hearing no's, but not really understanding what is wanted of them. So through positive reinforcement training, you can routinely reinforce behaviors you like, and they will offer more of these instead of other potentially creative but definitely less preferred behaviors. All right, so here we have a video that we use quite a lot with our high arousal dogs, and actually in general dogs that have, maybe fear or other behavior issues. This is a video of mat relaxation, which we can use to help a dog settle into a space. So mat relaxation was created by Dr. Karen Overall, and we are actually here going to be demonstrating the Suzanne Clothier variation. It is a great way to help high arousal puppies, adolescents, and adult dogs transition from fun into a more calm activity. So it can be very frustrating for them when they're having a ton of fun with you through either play or training, and then they experience a hard stop, aka the human just walks away from them. So this is a technique that we can use at the end of play or training to signal to them it's time to get ready to settle down. In order to teach my dog to lay down on the relaxation mat, I help her by luring her into a down on the mat. Then I feed her 5 small pieces of treats every 1 to 2 seconds to reinforce this positioning. Once I'm done with that, I will toss away a treat to reset her and repeat this step. You may have to repeat this frequently before your dog begins to offer a down on their own. Once your dog has been released and automatically returns to the mat and lays down without any cueing, they are ready for the next step. When my dog is automatically laying down on the mat once I have pulled it out, I can start building their ability to hold this position for a longer duration. Typically, when we build duration, we ask the dog to wait longer and longer between treats. What is important here is that I vary the time I ask my dog to wait between treats while still increasing the average duration. For example, I ask her to wait for 3 seconds in a down, then 10 seconds, then 5 seconds, then 15 seconds. I bounce between shorter and longer durations to reduce the likelihood that my dog will get frustrated and give up on the training. Once your dog can hold a comfortable position on the mat for about 20 seconds, then you're ready to start capturing calmer behaviors. During this step, I will continue to treat every 10 seconds, but if I notice signs that my dog is relaxing further into the mat, then I will offer additional reinforcement and reset my timer. In this example, Kismet does a calm chin rest, so I deliver a treat when I see that. I also continue to deliver treats every 10 seconds, regardless of her behavior, to keep the rate of reinforcement high and avoid frustration. Other signs to watch for that your dog may offer are taking a deep breath, Their tail may slow and come to a rest on the ground. They may shift their hips to the side, or they might even roll onto their side fully. You can reinforce these offered behaviors to help them relax more deeply during this practice.
So we've alluded to some concerns about separation or confinement anxiety. And some of the behavioral reasons that were previously listed for relinquishment included things like vocalization, destruction, house soiling. And if you don't have a camera to monitor when your pet is home alone, you may not realize your dog is doing all of those together as a manifestation of an underlying issue of separation or confinement anxiety. And this is a situation or a disorder where the mat relaxation training could be applied to help the dog relax eventually when they're home alone. I highlight this especially for pets, unfortunately, with a prior traumatic upbringing where an insecure attachment style may have developed, such if they were strays and had no secure attachment figure in the shelter, isolated in a pet store, or in a neglectful or abusive home, as they may be particularly predisposed to developing hyper attachment to their new, very loving owners in the form of separation anxiety, kind of similar to the attachment styles in children growing into adulthood. And this is a photo of my adorable little pup who we are working towards his hyper attachment. Advice for separation anxiety should include things like designation of what I call a safe zone, a safe space, a success station in the home, which is a place that the pet already gravitates to on their own and has pre-formed positive associations. And of course, so that it's out of harm's way if there is any concern for destruction or chewing. It is typically recommended, including in the textbooks that I learned, physical exercise before departures can alleviate anxiety and reduce excess energy that may contribute to anxious behaviors. But what I do see a fair amount in my own patients, specifically in the city, is that not only are they dealing with separation anxiety, but they also have a comorbidity of fear on walks in the urban environment. And so you may think for some dogs, let me take my dog on a long walk to tire them out before the departure. But all thanks to trigger stacking, if their stress hormones are elevated from the stress of a walk and they come back home and a few minutes later you leave, they're already starting at a 10, and that departure may be worse had that walk beforehand not happened. That is definitely not the case for every single dog, but definitely the nuances to take into consideration if your dog does struggle with a few different behavioral conditions. Of course, downplaying departures and arrivals is important so as to not increase arousal during these times. Practicing gradual departures so we don't push the patient over threshold or being too stressed versus lengthy departures all at once. And as I alluded to earlier, avoiding the use of punishment. You can include things like a food stuffed toy as an unconditioned stimulus that reflexively elicits a positive emotional response when eaten.
All right, so I'm going to share two examples of techniques that we use in our own training practices with clients to help dogs feel more comfortable with separation in general. So the first is a desensitization protocol. This is a sped up video of my work with an actual client. During desensitization, we figure out what experience elicits strong emotions from our dog. For example, their human walking out their door. And then we expose the dog to this experience at such a small level that it doesn't cause distress. As the dog shows maintained or increased comfort during these small exposures, we will gradually increase the level of the exposure. So, in this case, the duration the parent spends outside the home over many repetitions until they are comfortable at home for multiple hours at a time. So as you can see, this training looks very boring. It's not fancy at all, but there's actually a lot that goes into determining how long we have the mom in this case stay out for, what kind of body language we're looking at when the dog watches them exit and when they're completely gone from the home. So this is a typical example of a desensitization practice where you'll see the mom enters and exits multiple times, and the dog stays cool as a cucumber throughout. All right, Vanessa, I think we can move on to the next slide. Perfect. Awesome. Okay, so another technique we can utilize is counter conditioning. So similar to classical conditioning, during this technique, we use food paired with something aversive or scary to help your dog feel more neutral about the experience. So in this video, you'll see my clients using a treat dispensing machine to help their dogs get comfortable with their absence. Much like the desensitization route, we will gradually increase the time the parents spend outside while the dog is eating the treats. And once the dog is comfortable, we will also work on reducing the number of treats or the time that the treats are going to be dispensed for. I also want to premise that you do not have to use a treat dispensing machine like we do here. Sometimes dogs do very well with a food toy or a long duration chew, as Vanessa mentioned previously. So that noise that you guys may have just heard was the machine dispensing treats. You'll see the dog runs back to the machine and happily eats treats from his little mat on the sofa. And if you listen carefully, you'll hear more beeps and treats being dispensed. Maybe, or maybe we sped those up and cut them out of the video. But right, the goal is that the dog lays down in front of the machine or nearby, offers calm behavior, and eats the treats willingly until their parents return.
So, pivoting away from separation anxiety, another common behavioral problem that was listed for relinquishment was house soiling. First and foremost, we must always be certain that if there are truly urinary or stool accidents in the home, they're not because of an underlying physical or medical issue. So, if the accidents in the home are associated with any of the following clinical signs, and I know this is going to sound like a commercial as I list them off, but straining to urinate, blood in the urine, frequent episodes of urination, but with small volumes. That's called pollakiuria, excessive thirst in urination, straining to defecate or tenesmus, diarrhea, blood in the stool, constipation, or fecal and urinary incontinence, where the dog does not realize that they are urinating or defecating, or they wake up in a puddle of urine. If you see any of those clinical signs, the issue is 100% not a behavioral issue because those are not behavioral clinical signs. It's a physical thing, and a consult with a veterinarian and any indicated diagnostics is imperative. Provided that that is all ruled out and it is assumed to be a behavioral concern, some parameters to consider is that healthy adult dogs should be able to comfortably hold their bladders for at least 8 hours, and many do even longer than that overnight. That means, especially if your dog has some degree of fear outside on walks, this is especially critical for those dogs who may be aggressive towards dog walkers, but you're home and you're out of the house, excuse me, and you're gone for 8 hours. The adult dog should be able to hold it without you needing to bring a dog walker in to relieve them. And again, like I said, for dogs who are scared or triggered by walks in the city, you may not need to take them outside 5 or 6 times a day, just for the function of eliminating, or you could consider using a pee pad in the home. Many of my patients present with the complaint of accidents on the way out of the building to the walk in the elevator or the lobby. And it's not because they're being disobedient, it's because they're too afraid to do something so vulnerable like eliminate outside in an environment that is scary to them. And so they release their bladder or their stool. On the other hand, a puppy should be able to hold its bladder for every 1 month of age. So that means a 3-month-old puppy should be able to hold his bladder for 3 hours. A 5-month-old puppy should be able to hold her bladder for 5 hours, etc. When potty training a dog, you initially should take the puppy outside or to an indoor pee pad each hour, of course, when you're home. And if you're not, and if you do take the dog outside every hour and within 5 minutes they're not eliminating, return indoors and try again after about 15 to 30 minutes. Every time that your puppy urinates or defecates appropriately, immediately reward them within 1 to 2 seconds. If we wait 5, 10, 15 seconds to pull the treat out of our treat pouch or go to the fridge to get a treat, the association's gone and they have no idea why you're rewarding them. You can strategically take your puppy outside or to the pee pad when they're most likely to eliminate, which is usually within 15 to 30 minutes of eating or drinking, following play, exercise, and naps, and prior to confinement and bedtime, and upon being released from confinement. Once your puppy gets the hang of this routine, you can teach them to quote unquote go on cue by saying go as they're squatting to eliminate. As long as the puppy doesn't have confinement distress or claustrophobia, you can consider creating them to avoid accidents when you're not there to supervise. And again, punishment when there is an accident should be discouraged to prevent developing fear of the person doing the punishing and also reluctance to eliminate in the owner's presence. More often than not, these dogs just find an alternative place in the home and hiding to eliminate. Additionally, many owners find the accident when they come home minutes to hours after the actual accident is gone. And as this is all learning via association, the dog will have no idea why they're being punished. Simply clean up the accident with an enzymatic cleaner. The one that I use for my own pets is anti-icky poo. Enzymatic cleaner is important because dogs release pheromones, which are species specific chemicals in their urine and stool. They serve multiple functions. You may have heard of some pheromone collars, which could be calming. They have calming pheromones, but the pheromones in urine and stool are a different function. It's marking, and it may keep telling the dog to keep going in that same place. Instead of Lysol or something like that, you need that enzymatic cleaner to really break up via the enzymes the pheromone. Spray, let it sit for 5 minutes before wiping it away. And the anti-icky poo that I mentioned, you don't necessarily need to use anything like Lysol because that has already antiseptic properties. Finally, a top behavioral problem that is unfortunately probably not a surprise for relinquishment is aggression. Remember, as every behavior serves a function, so does aggression, many a time being due to fear and often compounded by territorial or protective components. Owners should be educated on canine body language to understand what the pet is communicating and how to prevent escalation. So this is a diagram that I created called the ladder of canine fear aggression. But again, there could be components of protective, territorial, etc. And essentially, as I go through in many of my appointments, at the top of the ladder, you see that the dog is very clearly communicating. They're uncomfortable with something in the environment by barking, growling, lunging, snarling, snapping, or biting, because inherently when that happens, you may move away. But a dog shouldn't immediately go straight up to growling, lunging, or biting to get their point across. Typically, there are much more subtle warning signs starting at the bottom of the ladder. They don't need to go in consecutive order and do every single one of these. But if over time the dog learns that these body language signs indicating fear, anxiety, or stress are not enough to get their point across, they will learn to do whatever they can to get their point across and escalate to things like barking, growling, lunging, or biting. So, some body language signs to familiarize yourself with that could be signs of stress: yawning, context dependent. If your dog just woke up from a nap and they're stretching and they're yawning, okay. But if it's in any other context, it usually means stress. Licking of the lips. If they're licking the lips because you're holding up a treat, it means yummy. Any other context, it means stress. Averting the gaze or looking away, squinting the eyes. Whale eyes is when you see the whites of a dog's eyes, putting their ears back. A super subtle one is when the dog is standing there. I often see this at the busy crosswalk. The dog is standing there taking everything in, and all of a sudden you see a forepaw lift. Those are all signs of fear and anxiety. If they are exhibiting these body language signs, but they aren't being recognized as I'm experiencing fear, anxiety, or distress, they'll escalate and do whatever they can to get their point across. One of the best things that you can do to try to prevent the escalation is recognizing these body language signs, capitalizing on those moments when the dog is exhibiting them and saying, okay, you're communicating, you're uncomfortable. Let's identify the trigger and either remove the trigger from you or remove you from the trigger so that you don't feel the need to rehearse the escalated behavior. So a perfect example of how I apply this is when it comes to handling and petting. I call this the consent to pet or the 3-second rule. And this is something to consider when petting your own dog or even a strange, cute dog on the street. As tough as it is, consider that as adorable as they are, their mere existence is not inherently giving anyone consent to pet or touch them, just like us. So instead, I'd recommend the 3-second rule, which is also a handout that we'll make sure to send out to all registrants after this. Ultimately, if the dog is laying there minding his own business, let him be. If you're really curious, you can try to interact in a hands-off way, such as by calling him over. If he still refuses, let sleeping dogs lie. It is much better for a dog to ignore something they're not consenting to rather than resorting to biting. If, on the other hand, the dog does come up to you or they're soliciting physical attention in whatever way they do, like pawing at you, nudging you, etc., and you're not seeing any of the body language signs on this ladder, they're giving you consent. You could pet them for 3 seconds, ideally not over the head, where somewhere where they can see your hands, like your neck or your chest, or their chest, excuse me. Pet them for 3 seconds, remove your hand, and look at the body language. And again, if they're showing loose, relaxed body language and none of those subtle signs on the ladder, they're giving consent. You could pet them again. On the other hand, if you move your hand away and they haven't moved away, but they're starting to become conflicted and unsure, and they're showing the whites of the eyes, or they're yawning, or licking their lips, or looking away, that's their way of saying, I'm not 100% into this anymore. We just stop touching them so that they rehearse over time. They can get their point across with that much less injurious body language. When we talk about aggression, one of the most important and immediate parts of the treatment plan is to identify the trigger and avoid it. Of course, training will teach the patient how to cope, but the patient, when they're exposed to the trigger for teaching purposes, must be in a headspace where they can learn. Similar to a person in the middle of a panic attack in the world's greatest psychotherapist's office, everything that therapist is saying is going in one ear and right out the other. It is not a learning opportunity. Exposure should not lead to any of those body language signs of fear, anxiety, distress, or aggression, because remember, that's a physical manifestation that their stress hormones are up. And where your stress hormones are up, it interferes with the neurobiological process of learning. And all that's happening here is the patient rehearsing the very behavior that we deem problematic. You'll hear me say a lot, the more we have the chance to rehearse a certain behavior, the more we will just keep doing it, which is why flooding or exposure therapy, especially when the patient is in distress and not in a headspace to learn, is not indicated. I try to take a very neurobiological viewpoint from this to explain it. Of course, I'm always happy to answer questions. I love talking about this. So, circuits of neural or nerve pathways in the brain are what is ultimately responsible for displaying certain behaviors. These neural connections involve a complex interplay between the genes our pets have inherited, similar to how a child might inherit anxiety or depression from their family. Dogs do inherit behavioral disorders from the parents. So, these neural pathways involve a complex interplay between the genes our pets have inherited and the surrounding environment's influence on the expression or silencing of those genes. And thanks to what we call neuroplasticity, those neural connections or pathways, which are repeatedly activated and triggered by the environment, based upon what the pet is exposed to are strengthened and maintained. Remember that we can't control the behavioral predispositions our pets have inherited, but we can control the environment that we elect to put them in. So, just as a quick example, let's say you have a puppy who, during the critical period of sensitization, which I'll talk about next, find themselves in an unfortunately abusive environment. Let's say that puppy also inherited from its parents a fearful temperament. During this time, the neural pathways which contain the genes expressing that fearful temperament will be maintained and strengthened because it's all the puppy is exposed to and rehearsing to defend itself. Now, let's say this puppy is relinquished to a shelter and you're able to rescue him, fortunately, at 6 months. You start to recognize as time goes on that around unfamiliar people, he seems to be exhibiting escalating behaviors like barking and growling. You have two options. The first option, which we don't recommend, is you can engage in exposure therapy, have the puppy around unfamiliar people, and potentially resorting to using a shock collar to punish the barking and growling in an effort to decrease the likelihood of those behaviors from recurring. But because of recurrent exposure to the trigger of unfamiliar people, the dog is at a high likelihood of displaying aggression into adulthood because with exposure therapy, all the dog did was give those neural pathways coding for fearfully aggressive behavior a chance to strengthen and maintain due to the recurrent rehearsal. Additionally, the dog hasn't learned that barking and growling isn't enough to the dog has learned that barking and growling isn't enough to get their point across because they want the person to move away from them. And those helpful warning signs may have been punished with a shock or a prong collar. And because no healthy coping mechanisms were taught, the dog is now at risk of escalating to biting. In the second option, which is what we do recommend, you instead manipulate your puppy's environment by avoiding unfamiliar people in uncontrolled environments while you engage in controlled desensitization and counter conditioning under the treatment of an approved trainer or vet behaviorist. Desensitization is ensuring that the patient is exposed when they're in a headspace to learn, exposing them to the trigger, to the unfamiliar person at a level or distance or duration or intensity where they're calm and able to learn. Yes, that doesn't seem like it's the problem, but that is where they start learning. By avoiding the very triggers causing your dog to bark and growl, the neural pathways coding for that inherited temperament aren't being activated. They're not being practiced. And so they weaken and their genes get silenced. Additionally, through behavior modification, your dog slowly learns to cope and form positive associations around these triggers in controlled environments, creating new neural pathways for better behaviors. With rehearsal of those instead, those neural pathways strengthen and you are left with a less fearful dog into adulthood. And obviously, another huge benefit of managing the environment so carefully is by avoiding liability. Um, Biting is a very normal part of the canine behavioral repertoire, and even with treatment, an aggressive patient can do serious injury or harm. So, nothing will ever take away the risk of an aggressive event from happening, and that's where safety management is crucial.
All right. So, as Vanessa just said, we can only elect the environments that we're going to put our dogs into, and safety and management is crucial. So, here we have a variety of management tools that we recommend to clients. Management tools are not only for ensuring safety in humans alike. As Vanessa just explained in the previous slide, they are so helpful to reduce the likelihood of a behavior because we can reduce our dog's ability to perform a behavior through management tools. That way, that behavior is not going to be continually reinforced. So many innate behaviors like digging are inherently reinforcing. Other behaviors like jumping on a guest when they enter are reinforced by external factors. And those both behaviors, in both cases, if dogs are allowed to continue those behaviors, they are going to be more likely to be performed in the future. So when you are trying to change the frequency of a behavior, you need to make it really hard for a dog to perform that behavior in the conditions you don't want to see it. Here, I'll give you an example of a dog who loves to chew and has started to chew at the legs of your coffee table. So in this case, you've identified that you need to provide a different chewing outlet and you're working on reinforcing them for chewing special bones that you bring home. In order to make sure they can't practice the behavior of chewing on the coffee table legs anymore, and instead shift them to those bones, you might use something like a gate or a pen, both of which are management tools, to block their access to that space until they've learned that bones are the more appropriate choice.
Like I meant, oh, sorry. Like I mentioned earlier in the example of that fearful puppy during his early stages, I alluded to that he was in the critical period of sensitization or socialization. For puppies, this is between 3 to 14 weeks of age, similar to infancy or toddlerhood for people. While we are always learning and processing information from our surrounding environment and life experiences, they are especially influential during both this period and another period called social maturity. Why? Neuroplasticity and specifically the competition between our neural pathways dictating our behavior, again, based upon what we've inherited, is happening at such an escalated rate that behaviors that are being rehearsed during this time period really strengthen and solidify, maintaining into adulthood. Social maturity in dogs is between 6 months to 2 to 3 years of age, depending on breed. Our social maturity as humans is late teens, early 20s. I only am saying what I'm about to say to really further validate the importance of, in a positive way, manipulating your pet's environment, especially during social maturity and how that influences behavior as a person, if they get diagnosed with a mental health condition, unfortunately, such as major depressive disorder, bipolar disorder, or schizophrenia, how old are they when they get diagnosed? Not when they're 2 and not when they're 80, but in their late teens, early 20s, because of the neuroplasticity going on during our period of social maturity. Similarly, the most common age of canine patients I see is during social maturity between 1 to 3 years of age. It's not at all uncommon for me to hear that as a puppy, the dog was not fearful towards X, Y, or Z trigger, but now all of a sudden, at 10 months or 1 or 2 years of age, we're seeing this problematic behavior because, again, of the neuroplasticity going on based upon the ever influential environment during their period of social maturity. So, just to quickly go over what we can do when we get a puppy during the critical period of socialization, we do want to take into consideration making positive associations, as Maddie will talk about. Of course, as a veterinarian, I just want to do my due diligence and say during this time they're going through their vaccine protocols. What I will say though is that when they get their boosters, they mount an immune response after about 2 weeks. So once they get their first vaccine and then their second booster after 2 weeks, there is some degree of immunity. This doesn't mean that the dog at that point should run around other dogs, but it is safe to take them out, for example, in a stroller on the clean pavement, and also enroll them in some puppy classes with other healthy puppies with proof of up-to-date vaccines. And in fact, there was a study that was done that showed that puppies who were not completely finished with their DHPP or DAPP distemper parvovirus vaccine series, that went to puppy play group with other puppies that were in the series as well, but didn't completely finish them, were at no higher risk of contracting parvovirus than dogs who weren't in those puppy classes. Because again, it's all healthy puppies who have mounted some immune response, and it's a very small contained group.
All right. So with that, I'll talk to you guys a little bit about how we perform good puppy socialization. And I do want to note that while we do prioritize socialization during the critical period of your puppy's development, these socialization practices hold true and should continue through adolescence and adulthood if needed, as we'll talk about on the next slide. So one of the goals of socialization is safe and positive or neutral exposure. Um, I do want to make it very clear that the goal is not to throw your puppy into the deep end of a social experience and let them fend for themselves. Another common misconception is that socialization for puppies is just about play with other puppies. And while that is important, we should actually prioritize teaching puppies about interactions with a variety of people, loud noises, fast-paced environments, and even handling. I always try to impart on people that the most crucial aspect of socialization is allowing your dog to investigate new things at their own pace and giving them an escape route when needed. So puppies typically get very tired very quickly. They should be sleeping like 16 to 18 hours a day. This means that our socialization attempts should be short and sweet, under 30 minutes, several times a day, in order to encourage building positive associations with new things. We can bring food, toys, and anything else along. A good example of this would be when you first bring your puppy to the vet. You can bring a little squeezable salad dressing container filled with wet dog food. And as the vet is handling your puppy, you are delivering little licks of dog food to pair the handling of their body with a reinforcer. One note, as a dog trainer in one of the busiest cities in the US, I cannot stress the importance of exposing your puppy to the sights and sounds of the city enough. And this does mean multiple times a day during the critical period. So I just wanted to highlight again that this can be done safely, as Vanessa said, either via short trips to the sidewalk on clean pavement, in bags or in strollers. I think Vanessa also mentioned that the biggest issues she sees is dogs who are fearful when walking through the streets outside. It is also one of our largest behavior problems that we deal with.
And one other quick thing that I forgot to add, when you are taking your puppy outside, make sure it's the clean street, like Maddie had mentioned, but also ideally no standing water or soil, because that is definitely where they can contract things like leptospirosis, which is part of their vaccine series.
Yes. Okay. So while we ideally want to be doing our socialization during the critical period, some of our adolescents and adult dogs come into our lives after that, which just means that we have to be a little bit more thoughtful about our socialization processes because our dogs already have preconceived notions of what is safe and what is not in their environment. And this should play actually a huge consideration in your choice to adopt a dog from potentially another country or even another state. So dogs, take New York City, for example, dogs who haven't been exposed to an environment like New York City are much less likely to feel comfortable in this environment right off the bat. And the reality of this situation is that most of them do struggle. But in the case that we have an adolescent or adult dog that needs, some help with socializing to a new environment, we will always take a slower approach. We want to focus even more on pairing new, potentially scary environments with good things. We do take a very measured pace and we do our best to always avoid flooding. So, again, that's exposure in large quantities to something that evokes fear or anxiety. We don't believe that this is ethical or an effective way to teach dogs that their new environment is safe. And in regards to dog-dog sociability, we always try to encourage people to remember that as dogs age, just like humans, our social habits and theirs change. So they might not get along with every dog they meet, and forcing them into dog social situations for the sake of socialization might make them so uncomfortable that they end up eliciting aggression, which we always want to avoid. I do want to give you guys an example of how we might work on socialization for an adult dog that comes to us. So first things first, we identify in what environment or in what situation is your dog showing discomfort. And then, for this example, I'll just use the busy street. So then from there, we think about at what level of exposure does your dog seem comfortable. So for example, that might be just past your front door. Then we introduce enjoyable activities in that space. Some examples are puzzle toys, chews, scent work, mat relaxation. Once your dog can comfortably engage in those activities just past your front door, you can gradually work on moving these activities away from your home towards the hustle and bustle of the street. We do have a variety of other socialization options for sensitive dogs, but we found that these are the easiest for clients to start working on themselves. All right. So, to wrap up, we did want to talk to you about how you can find the right trainer. Um, as we've discussed throughout this presentation, trainers should practice humane, evidence-based, and reward-based training methodologies. Ideally, they will have an education in learning theory, psychology, and applied behavioral analysis. They should also be able to recognize when a dog is showing body language signs of distress, even if they're very subtle, and adjust the training plan accordingly to avoid flooding a dog in the presence of a trigger when that trigger intensity is just too high and pushing them over a threshold. Good trainers should also know that pushing a dog to work when they are over threshold or when super stressed will not result in them learning any healthy coping mechanisms and is only neurologically rehearsing problematic behavior. Basically, the trainer needs to truly understand the difference between sensitization and flooding. We don't recommend trainers who engage in any punishment-based methodologies, including balance training, which, if you've heard of it, is kind of a sneaky way of saying they combine both positive punishment and positive reinforcement. Given that, there should be no leash corrections or punishment-based tools that are recommended by your trainers. These include choke, shock collars, prong collars, citronella collars, and your trainer really shouldn't be talking to you about method concepts like alpha or dominance, as those theories are not scientifically accurate. I'd also like to note that if you are working with a great positive reinforcement trainer, they will be open to hearing why you may be using one of the tools that I just mentioned. So, for example, an e-collar or a shock or a prong collar. And they should work with you to create a plan towards removing the use of those tools over time while ensuring that you feel safe navigating the world with your dog. It can be tough to find a trainer that meets all of this criteria, and there is a lot of misinformation and misleading happening on the internet. So we encourage you to book an interview with a prospective trainer. Many offer free consultations or low-cost 30-minute virtual sessions. You can also look out for certain credentials listed on the slide here. These are CBDTKA, KPA, CDBC, ACAB, CAB, or FFCP. I won't go through what all of those mean, but I know you guys will get some resources to finding good trainers that have these credentials in the accompanying links. All right.
So here are some references that we alluded to in the PowerPoint. And now I apologize that we did go over. There was just a lot that we had to share. We want to open it up to any questions.
Well, thank you. That was wonderful. We really appreciate your time and just sharing your expertise. We have some questions. If you want to unshare your screen and then we can see you guys. Let's see. So we'll get to, yeah, again, as many as we can, but I just want to reiterate that we'll be sending out a link to this tomorrow, along with many, many, many links to really wonderful resources. So again, if you missed anything, you will send that out tomorrow. Okay. So we had a couple of questions about the time in holding their bladder. Can a senior dog really hold a bladder for 8 hours? Does that affect it, the aging, affect it?
Um, so age is just a number.
Mhm.
And so ultimately, if the dog can't hold the bladder for 8 hours or so, there probably is some sort of medical condition, which isn't unexpected as we age, but that is definitely something to work up with your veterinarian. For example, if they start to develop urinary incontinence, or that could be secondary to some neurologic issues. Like there's a whole bunch of different stuff. But yes, unless there is an underlying medical or physical issue, an adult dog, regardless of age, should be able to comfortably hold their bladder for up to
Okay.
8 hours.
Okay, great. We have someone asking again that they find that their dog will urinate if left alone more than 4 hours. But again, I think check all of the medical, check veterinary issues first, right? So,
Absolutely. And potty training 101, and also make sure get a camera that there's no other signs of separation anxiety. Because if the accidents are only happening when the dog is home alone, that could be a sign of separation anxiety.
very good. I wanted to get your thoughts on, you showed the automatic treat dispenser. I know there are some where you can talk to your dog. I know there's like, if you, any thoughts on that one? Like talk to your dog through the treat dispenser.
Yeah.
Or
Um, so I have had limited success with your voice. Although I will say, and this is just anecdotal, but I was working with a veterinary behaviorist who recommended that a client use a kind of like life-size doll of themselves, and they played a recording of themselves talking, and it did help that dog. Again, I would say that the research on separation or treatment of separation issues is fairly new, and we don't really have many protocols that are, well researched. So you can absolutely try it, and if it doesn't work, then you have to go back to the drawing board. The one thing that I would say regarding the treat machine and our choice to use specifically the brand was the Treat and Train is that when we are doing our treat-based training protocols, we do want the treats to be able to dispense on at a very reliable rate. So I have tried to use something like I think it's the Eufy camera that has a treat hole and you can dispense treats by tossing them to the dog. Unfortunately, the delay between when you think you're trying to dispense a treat and when the Eufy actually dispenses it gets a little bit in the way of the timing of our protocols.
yeah, okay, yeah, that's very good. Um, let's see. Okay, do you train virtually? We have someone who's from Michigan. What do you think about virtual training? I know you do a lot of it now.
Yeah, we definitely train virtually. So for the record, separation issues, we only train virtually
Right.
because if I come into your home and ask your dog to leave, their body language is going to be very different than when you're leaving and I'm watching them on a video. We also do a lot of virtual training specifically for dogs who their progress would be potentially hindered if we entered their apartment. So if they have significant fear or aggression issues, we might not be able to like we talked about, might not actually be able to teach them anything because in that state of intense fear or stress, they're not necessarily in a place to learn. And it can also be not safe for the guardians, the dog, the trainer who's coming into your home. So we do quite a lot of work virtually.
Okay, great. See, I'd like to do scent work outside with my dog, but he will put inappropriate things in his mouth. I just want to control the environment. If you come to if you're in the city, please come to our paw day. Then we'll have a scent workstation there. Let's see. Any thoughts on that though? I'm not quite sure. Putting in inappropriate things in their mouth.
Yeah. Well, that's where a management
That's
tool would come in, like a muzzle.
Mhm.
So that could be like a mesh muzzle or a Baskerville, like a basket muzzle. The other thing I will say is often if you're doing something like scent work and you're teaching your dog to find a treat outside, if you give them something very specific to find, they're not going to be focused so much on the other things they could be potentially putting in their mouths.
Okay, great. That's very good to know. Um, let's see. We had a question about introducing cats and dogs. Any thoughts on that?
Um, yeah, so it is a grab bag. For example, my parents have that little mini poodle and a cat, and they get along swimmingly. There are some dogs that might be predatory towards cats as they are small animals, and that unfortunately is not a safe situation. But whenever you're introducing new pets to each other, regardless of the species, it should always be done very slowly. So even when I introduced my two new cats to each other, I had them physically and visually separated 24/7 behind a closed door. It was in my studio apartment, so I was able to navigate it. Dancer had the bathroom. Little Prince, who was there first, had the whole room of the huge studio. They were physically and visually separated for a full 2 weeks. I did scent swapping during that time. Whatever bed Dancer laid in, I gave to Little Prince. Same thing for her. And I associated it with treats. I fed them on opposite sides. Once I was not seeing any body language signs of fear, anxiety, or distress, you could then do a protocol where there is a physical barrier like a baby gate that the door is no longer closed, but you still cover it with a blanket. Once that's okay, you remove the blanket. That it's a desensitization counter conditioning protocol. So very, very slow introductions. Yes, it's slow, but it's to try to set them up for success while you make positive associations.
Okay, wonderful. Let's see, we have a question about a head halter and asking, do you not consider that aversive? Or why, I guess.
That's a great question.
Yeah.
No, not if it's being used correctly. So definitely work with someone who is skilled in using the head halter. What I will say is, of course, I don't blame a dog for feeling concerned about having something on their face without knowing why. So we also do generally recommend making them desensitized and comfortable and positive by very slowly and gradually building up the duration with which they're willing to wear it. And if it is used correctly, it could be used as a good tool to try to control their head if they're moving around, but it's not like we're yanking on it so much so that it's causing any sort of pain or discomfort.
Okay, great. Okay, we have a question. I foster many dogs. Thank you for doing that. I foster many dogs, and my older dog is a great dog trainer to many puppy mill survivors. However, there are some dogs she wants to play very roughly with, and not others. Why does that happen? Individuals? I don't know. Yeah, why I guess, yeah, or some, we don't
Yeah,
know.
Vanessa, do you want to take this one or do you want me to?
Um, sure. Yeah, and then of course interject with whatever you have. So the question is, why does the dog seem to have issues with only some dogs, but not
Mhm.
others? It is just like kids in a schoolyard or even us as adults, where we're going to vibe and mesh well with some others versus not. And the way that we can try to discern from the get-go, though it is hard to predict if there is going to be a concern, is slow introductions and looking at body language signs. I oftentimes find that it is two dogs that struggle with behavioral conditions or social anxiety that may struggle with each other. Some are more introverted, some are more extroverted than others.
Very interesting. Yeah. Um, okay, I have a 5-year-old golden doodle who's awesome and very well behaved. He was fixed when he was 6 months old. But he has a bad habit of humping people's legs. He does not hump other dogs. He does it to me at night before I go to bed, and he does it to other people when I have people over. Is it anxiety? Is it attention? Is he overstimulated? Any thought?
I could take this one, and of course,
Okay.
Maddie, please interject. So, um, you are correct. As your dog was neutered or castrated, he no longer has testosterone. Humping or mounting behavior is a normal species specific behavior which serves the function of sexual arousal. However, when there is no testosterone left, that means we are left with a species specific behavior, but exhibited out of context. And that is what we call a displacement behavior. A displacement behavior in humans, for example, is when we're nervous and we're tapping our feet, we're picking at our cuticles. It doesn't seem to serve anything except with the air of releasing some sort of frustration, anxiety, etc. And you're a specific example where your dog was not doing this to another dog, because I do see this a lot at dog parks where dogs are struggling with social anxiety with each other, but instead it's directed towards you. It could be because it's the end of a high energy day. So perhaps we want to redirect the dog with something that's going to help them self soothe, like a lick mat or a Kong, because remember, licking releases endorphins. Again, you could perform a functional behavior assessment and think, okay, the problematic behavior is the mounting behavior. What is going on in the environment correlated with the onset of that behavior? If we could come up with a pattern, perhaps whatever that trigger is maybe a little bit stressful for the dog, and let's modify the environment to decrease the frequency with which he's exhibiting that behavior.
Okay, terrific. I wanted to ask, or just if you could talk a little bit about how the two of you work together, I think is really helpful. And I know we have Dr. Spano, I know you have a very long waiting list, but I know you recommend some trainers, and what is that, basically, how does that work for people? Yeah. Yeah.
I always make the equation that I am like the psychiatrist, and then Maddie, if you agree, she's like the psychotherapist, where we really should work in tandem together. Of course, my job is not only to prescribe medications. Medications aren't indicated in every single case, but many a time, similar to what I said earlier in the presentation, if the patient is struggling with some sort of fear, anxiety, or distress, it's like going to a talk therapist's office in the middle of a panic attack. Everything they're saying is going in one ear and out the other. And so potentially a supplement or medication should lessen that intensity to make the patient more receptive to training. And I do go over in my appointments behavior modification and training protocols to help teach your pet coping mechanisms in situations that they may struggle. But Maddie, and of course I'll let you go ahead, is really the one who is helping the owner carry this out. So we work in tandem together.
Yeah. So I think sometimes it's a chicken or egg situation. Either if I'm working with a client and we feel like, this dog is consistently over threshold when we're trying to work with them, they're not in a place of learning, then we refer to Dr. Spano and try to bring on medication. At that point, we might even pause training for a little bit to give the medication some time to take its effect. Or Dr. Spano sends me dogs that have already started medication and are in a good place to start the learning process. Um, Often what we do is we look at, the behavior report from Dr. Spano's team. I am, as a behaviorist, I do also keep track of with my clients, how is your dog doing on these medications? Because often I do see the dogs more frequently than Dr. Spano is able to with our training packages. So that might include, having our clients start working on a behavior tracker on like a Google Doc where we can then eventually send that to Dr. Spano. So we do things like making sure, we're seeing changes on the behavior meds and that they're reporting those changes to Dr. Spano reliably. And then we bring in, a variety of management techniques, counter conditioning and desensitization techniques. And, we look at our approach as a little bit more whole bodied maybe than some. So, when I go to a client's home, I'm talking to them about, what do their poops look like? How much exercise are they getting? To make sure that if there are also any other issues that seem like they might be more on in the medical realm, then I can flag those and send them back to Dr. Spano for them to be treated appropriately.
Okay.
And just to quickly add on too, there are a fair amount of trainers out there. And as we talked about at the end of our slide, I definitely want to make sure for my patients, because this is not just obedience, that the trainer is equipped in understanding applied behavioral analysis, learning theory, very akin to human psychology. And so I have a small list of trainers, and of course, Maddie is at the top, that I highly recommend that I can trust, understand all the nuances in ensuring that we are not pushing the patient into a situation during training where we're just not setting them up for success.
Okay, super important. So thank you again. This was really, both of you, fantastic, and we really appreciate your time. I know we're a little bit over, but I think it was really worth everyone staying around. So we will again send this out tomorrow along with a ton of resources. But again, thank you all so much for joining us. And Dr. Spano, Maddie, we really, really appreciate your time. Again, I'll just mention our next webinar will be April 22nd, poisons and pets. And then we hope that you'll join us for Paw Day on May 2nd. And thank you everyone again. We're getting lots of hearts and everything. So again, we appreciate you joining us tonight and have a great rest of the evening. Take care, everyone.